At Moore's UC San Diego Cancer Center, oncologist Grace Koo specializes in treating blood cancers like leukemia and lymphoma. When she tells patients the particulars of their disease and how to treat it, they're often in shock.
And oftentimes patients, when faced with the initial diagnosis and having to go through this life-changing, decision of chemotherapy and learning about their cancer, fertility isn't always on the top of their minds.
But for patients under the age of 44, fertility is definitely something that needs to be considered. Certain cancer treatments can damage a patient's fertility or even cause sterility.
So anytime a patient is undergoing chemotherapy, I do want to discuss with them the potential impact on their fertility. Certainly, there are some regimens that have more of an impact than others, would be one thing. So the intensity of the chemotherapy, the type of agents used in that chemotherapy.
Doctors estimate this year about 1.7 million Americans will be newly diagnosed with cancer. The vast majority of them will be over 55. Even so, during a recent 4-year period, the National Cancer Institute says nearly 9% of cancer patients were under the age of 44. Christina Montana, who lives in Lemon Grove, was diagnosed with Hodgkin's lymphoma when she was 14. That's a cancer that affects the lymphatic system. Shortly after she got her diagnosis, Montana was told the radiation and chemotherapy she'd receive could damage her fertility. So Montana consulted with a fertility specialist.
My doctor actually recommended it because they told me everything that could possibly happen. They said it was possible that I couldn't have kids on my own after it. And it was just a possibility, but I still thought I should do it.
Montana says her first visit with a fertility doctor was strange.
When I first met with her, it was a little awkward for me because I never thought I'd have to do that. And first they did kind of I think it was like an ultrasound of my ovaries, and they put like this gel on me. It was weird. And she showed me everything, explained everything. She showed me everything on the monitor, what she's looking at and what she's looking for. She made everything super clear.
Montana got a series of injections to stimulate her ovaries. Then some of her eggs were extracted and frozen.
So this is a tank of liquid nitrogen. We have canisters which contain patient specimens stored in vials, frozen, minus 196 degrees centigrade.
Dr. Catherine Adams offers a tour of her lab at the Reproductive Sciences Center in La Jolla. It's one of the region's many fertility clinics. In this room, eggs, sperm, and even embryos are preserved in a frozen state for future use. Women's eggs are extracted in this part of the lab and placed in a special incubator.
It's a mobile chamber which keeps the eggs warm. We have gas, CO2 gas flowing in, so we can keep a very stable environment for collecting the eggs.
Clinic director Dr. Samuel Wood says fertility preservation for people with cancer is a relatively new field.
It's only really come into its own since 2006. And I think we're all still trying to figure out exactly how all the pieces fit in. But it's definitely multidisciplinary. Many different types of physicians have to be involved. They need to get involved early. And when they've done so, we've seen outstanding results.
Dr. Wood says the success rate for women who go through fertility treatment depends on their age at the time their eggs are removed. He says success rates of 60 to 80% are possible.
And so there is an outstanding chance that especially women under the age of 35, if they go through either embryo freezing or egg freezing, there is a very good chance that they will end up actually having a healthy live birth.
Dr. Wood says despite these results, only about 5% of female cancer patients take advantage of fertility treatment. Part of the reason may be the price tag. Harvesting eggs can cost up to $15,000, and most insurance companies won't cover it. But there's another factor. Studies show only about half of all oncologists tell patients that cancer treatment could affect their ability to have kids. Christina Montana thinks that's a shame.
Even thinking about it, I just feel terrible for the people who didn't know. I'm just I wish they had the option.
Kenny Goldberg, KPBS News.